This special release podcast episode was originally recorded during the 2022 Beyond Clean Expert Series Conference, the industry's only 100% PowerPoint-free educational event. If you prefer to watch this interview, you can access it and over 200 other CE programs by visiting beyondclean.net. Thanks for listening and keep fighting dirty.
Thanks again for joining us. I'm Brett Norton with Beyond Clean, and you are watching the second annual Expert Series Conference. We've also partnered with Power Supply, so we've got some experts from that team as well. So really looking forward to having everybody with us today. So thanks again. Wanted to highlight a couple of features on the screen. There is a resources window with exclusive Beyond Clean website links. Especially, we've got the Expert Series portion of our website, so go over there. And we also have downloadable PDF resources for all the Expert Series submissions throughout the month. So please head on over there. We've also got the micro-credentials anniversary giveaway that we've highlighted earlier this week during SPX. So please make sure to jump over there and check out the details. Some other housekeeping pointers, I guess, is to make sure if you have any issues with the screen or audio, make sure to go ahead and refresh your browser. About 99% of the time that fixes the issue. So just make sure to do that if you're having any issues with screen, video, or audio. And we will make sure, and if you have any questions or anything, we'll make sure to answer those on the back end if you have any technical issues. So why don't we get to it with our next two speakers. Craig Ford is the founder and president of SterileBits Incorporated. He is our Beyond Clean instrument protection expert. So he's with us for his first year. We've had some great submissions starting in January of this year all the way up till now, and some great content that Craig has given us to just build the industry and help with industry knowledge on his side. So thanks, Craig, for that. Craig has 20 years of experience as a sales rep and distributor of implants, and he believes in listening to clinicians and technicians to better improve healthcare practices. Once again, joining us is no stranger, Hank Bouch. He is the founder and president of Beyond Clean. For those of you who don't know him, but I'm pretty sure a lot of you, or most of you do, he's an award-winning sterile processing leader, founder of 2 statewide HSPA chapters, conference speaker, and author of over 150 sterile processing articles. The title of today's presentation, or discussion I should say, is Defensive Maneuvers, going beyond the basics of instrument protection. Are your peel packs crumbling around you? Are you seeing holes, rips, and tears? These two guys will identify instrument protection best practices and the actionable steps SPDs can implement to improve their current instrument protection practices. Discover the instrument protection design and production processes and the important role customer feedback plays in future protection innovations. So please join me in welcoming Craig and Hank.
What's up, Sterile Processing Universe? I am Hank Bouch. Thank you for the intro, and welcome, Craig, to your first, but hopefully your first of many Expert Series conferences with us.
Well, thank you for having me. It's a real honor, I'll tell you. It's a privilege to be a part of the Beyond Clean group here, so I'm very excited to be here.
So I've been starting off these sessions with a couple of pop quiz questions because one of the designs and structure of this conference in particular is we are PowerPoint free, so no slides, just going to be a casual, fun conversation, but a ton of education and live engagement from everybody who's tuning in the conference. I know there's going to be a lot of folks listening to the podcast version of this. It's going to come out later. So if you're listening to the podcast, we love you, but I'm sorry we can't take your questions because it's going to be a couple of weeks down the road. But if you're tuning in live with us, throughout the entire session, if you've got a question or comment about the conversation, let us know, and we will pull it right up and talk about it in the moment. You don't have to save it until the very end like you normally do. And that way we can have a nice back and forth convo with the folks in the front lines actually getting all this done, not only in sterile processing, but we've got a lot of folks tuning in on the supply chain side of things. Our audience members from the Power Supply brand, and we are in partnership with our first case team. And so we're pulling in a lot of perioperative folks to get their nursing contact hours and educations as well. So we got a lot of different perspectives, Craig, tuning in today. Right. And I'm going to try to present the questions, to kind of hit a lot of those angles. But as we get started off, I want folks to get to know you a little bit more and get to know how you think, maybe. Okay. And I was talking to you a couple of weeks ago about, of all things, horses. So I want to give you a pop quiz here to define the difference for us, for people who are not horse experts, right? What's the difference between a thoroughbred and a quarter horse? Can you kind of set us straight on that? Okay.
That's a great question. Actually, I have some history. The quarter horses were actually founded in Texas, down in South Texas, at a ranch called King Ranch, a very famous ranch. They bred a thoroughbred, I forget his name, with some other pony or whatever. They came out with quarter horse breed, but they bred those for working their cattle because they had a large cattle operation. But anyway, so I actually kind of I have a equine science degree from Louisiana Tech, and I trained racehorses for the first 5 years of my life post college. My family had horses at the time, so I basically broke the babies and got them ready for the track, and then we'd send them off to the track, and another trainer would take over there. But thoroughbreds are bigger, they're longer, they're more like long distance runners. Quarter horses are shorter, stockier. They're made for cutting and moving quickly and getting in and out of cattle, herds and things like that. So, if you really want some more detail, thoroughbreds have long twitch muscle fibers, and quarter horses have fast twitch muscle fibers. So they're different that way. So anyway, awesome. A quarter horse could probably outrun a thoroughbred in 100 yards, but a thoroughbred will take off after that and beat the quarter horse. So.
And so if you were to define your personality in one of those categories, thoroughbred or quarter horse, which one would you be?
Oh, man, that's a good question. Being an entrepreneur, you need to have a thoroughbred kind of mentality because you need to go the distance, right? So okay. Quarter horses are, short. They run 100 yards, they're done, for the day, right? Well, you can't be that, have that mentality if you're going to be a manufacturer, because, just right. Getting a product to market takes a lot. It's a lot of effort because there's a lot of trial and error. There's a lot. You try one thing and it doesn't work well, then you go back to the drawing board, you try another one, you tweak it. So it's about perseverance, basically, and running a longer race, quite frankly.
I want to pick up on that theme because that is a very important, but also, I think, encouraging topic that we can get out of this session, because you're one of the guys, and one of the reasons I started with that is your background is not traditionally in healthcare, like at least at the very beginning, like you've got a lot of experience after the horse racing days, right? In healthcare, but it wasn't like you were born into a healthcare family, that you went to school to do things in healthcare, and yet here you are in that story of coming from all these diverse backgrounds like we do into healthcare and into sterile processing in particular, and then seeing a problem and taking that next step of doing something about it in an innovative fashion. I want to tell all of those stories that we can, because it inspires people out there who also have ideas, but just don't know what to do or how to do it. So we'll talk about that a little bit more. To tie in that first question, though, just real quick, it also connects to my background in sterile processing, because I began my career in Louisville, Kentucky, and I didn't move there because of the horse racing and because of the Kentucky Derby, but man, you move there and it becomes a part of your soul, and like that is a big deal in Louisville, Kentucky, all about the horse racing. And as fate would have it, I now live in Lancaster, Pennsylvania, and we are surrounded by Amish. If you don't know anything about Amish, they are like no cars, and they're riding around in horse and buggies. But what's interesting is the horses are thoroughbreds. And it's just kind of a random connection there. So, okay, let's get to the next pop question here.
Well, I got one thing I want to comment on that because it's kind of fun, right? Just fun. So back during those training days, one of my jobs is I had to haul mares up to Kentucky for breeding season and whatnot. So I don't know how I made this happen, but there is a famous ranch called Claiborne Farms, which is where Secretariat stood, one of the few Triple Crown winners. And I got to meet Secretariat, and I don't know. I have a picture of me and Secretariat, standing together, and I'm like, I don't remember how. I mean, imagine some guy walking up, knocking on the door, go, "Hey, can I have a picture with a Secretariat?" A multi-million-dollar sire, But I don't know, for whatever reason they let me do it. So that's awesome. That's one of my photos on the wall is me and Secretariat. So, anyway.
Such a nerd. I knew you're a packaging nerd, but now I know for sure that you're a horse nerd.
Hey, you can't be afraid. Just go knock on the, all I can say is no, get out of here.
That's right. Okay, completely switching gears. I know your background is in the kind of spinal implant world, and I'm assuming that you're going to have an opinion on this next question just for fun. In general, and I know there's going to be exceptions out there, but who is nicer, your orthodox or your neurodox?
Oh my God. One of my best friend is an ortho spine surgeon, and my other best friend is a neuro spine surgeon, so I hope they're not
So anybody stick out, are you going to say they all have their good days and bad days?
That's absolutely right. Everybody's got their own temperament, right? So, my neurospine guy, he went to Yale, and I think he was president of the class, and he was also a DJ at night. So, he would always have music in the OR, and he'd bring his own. Back then it was iPod, that's how long ago it's been. But anyway, and then the other guy, he was a. I don't want to say anything mean, but you'd be at the scrub tank talking or whatever. He'd be scrubbing, blah, blah, blah. You're talking about, this weekend was so fun, da, da, da. The minute he backed into the OR, it was completely different guy, just night and day difference. And then he'd break scrub and it's, okay, let's go. Let's talk about, what we're doing this weekend kind of thing. So anyway, just a lot of different personalities, and just, that's what they do is hard, and, I respect all of them. So
the takeaway, I guess, from your answer is that doctors are people too, right?
I don't know who would sign up for that job. It's just, I don't know. It's tough stuff. It's hard stuff.
Okay. Our final one, and this is kind of a segue, but kind of a fun question too. When you're at the supermarket and you're checking out, and the checker asks you, paper or plastic, what do you say?
Oh, man. I'm going to make some enemies probably here. I don't know. We usually carry our own bag, right? So
okay, look at you. Okay, good.
We take our own bag, But so I'm recently transplanted from California to Texas, and I will say that there's two different thoughts about that and all that kind of stuff. So I'm just trying to adapt the best that I can in my new environment. And,
I asked that for a reason, because here in a minute we're going to be talking about sustainable solutions in healthcare, right? So that's the connection, and I was kind of curious about that. But so I know we jumped kind of sideways to this, but for people who don't know who you are, like I know we gave the bio at the beginning a little bit, and anyone who has read your expert series, on the last page of all those PDFs is your short bio, but obviously there's a lot more to you than 150 words. So if you can describe yourself for the audience today, and why you fell in love with instrument protection of all things. Like, you could have done a lot and have done a lot with your career. Like,
Yeah.
why this particular topic has caught your attention so much.
Well, so yeah, I do not come from a sterile processing background. I was a spinal implant distributor for Zimmer Spine for 15 years. So I started out as a rep, but then I evolved and became the distributor, and I took over all of Southern California, which included Los Angeles down to San Diego, all the way out to Palm Springs and Hawaii. So it was a very, very large territory. I had about 70 surgeon customers that use our products every month, and I've had about 10, 15 sales reps at any given time, and had $20 million worth of inventory that we supported consigned trays with and loaner trays with. So, we were busy. We were going all over the place. We were in basically every hospital in Southern California at some point or another, so covering spine cases. So, and I covered cases too. I started out as a rep, as I said, but I had fell in love with being in the hospitals, and I miss that right now because I'm not in there as much as I want to be. But I love being an SPD, and they do things that they're smarter than I am in that world, and I love standing in the OR, as well. So, but during those 15 years, Monday through Friday, I was in some OR somewhere and some SPD as well. So, and you just watch things, you see things happening, you're going, wow, there's got to be a better way than that, and you see some things that are really good. You go, wow, that whoever did that did a good job, and then, I was always impressed by dumping of instruments onto the sterile field. I just saw a lot of that, I saw a lot of mishaps, and trying to pass off, and it got dropped or whatever, it got contaminated or whatever. And that left an impression on me. And, anyway, so, what the funny thing about this, is that we would get to experience the environment, different environments. Like, so we'd be in, let's say, Mission Hospital one day, and we'd see them deal with a problem or an issue. And then we're able to take that solution to a different facility. Like that, we would see the same thing happen a week later at a different facility. And we'll, hey, you know what? We saw this happen over there, and this is how they dealt with it. So I feel like we're like bees, we're cross pollinators, we could take, right. So we could take things that we observed, and help other facilities with that knowledge and stuff. So I think there's a lot of value to that. But by nature, I'm kind of a problem solver. I just watch things and I try to make them better in my mind and stuff. So when my days with Zimmer were over, I thought, you know what, I'm going to create a company and we're just going to solve some problems. We don't, some companies make products and then create a problem that product will solve.
You didn't know, but you need this.
yeah, didn't know that, but this is going to help that out. Well, we're the opposite. We're a small boutique company. We're not a billion-dollar corporation, but so we like to help out solving problems and stuff like that. So,
out of all the problems those you could have solved, like connect us to this instrument protection puzzle. Like, why did you zero in on that? And then, in particular, like I referenced earlier, talk us through that kind of innovative journey, because like you saw the problem and you said, I'm going to do something about it, but there's a lot of in-between steps that I don't think folks realize in that journey of entrepreneurship and the journey of innovation. Can you kind of lay some of those out for us? Yeah, so the love for instrument protection came, I think that instrument protection is synonymous with sterile barrier protection. I think this instrument protection, that term is too narrow, actually. I think that, our vision and my passion, because I did see, the difficulties in passing off instruments and things like that, and how important maintaining sterility is, that just became, I don't know, it spoke to me, more than anything else. I don't need to design an instrument or an implant or anything like that, but I just thought I might be able to help improve, maintaining sterility of an instrument, from sterilization to the physician's hands, right? So, I think that, our passion, our mission over here at SterileBits is to create an environment within the pill pack that protects the sterile barrier and the contents of the pill pack. So, I think
and I may be wrong because I'm fairly new to the industry, to the sterilization, the SPD industry, but I think the pill packs, you got the pill pack manufacturers that make the pack. That's great. And then you got some instrument protectors and stuff like that, but tip protectors, whatnot. But I don't think really enough attention has been given to that ecosystem within that pack. What's really happening there, and how can we really minimize the risk of that getting impacted in a negative way, right? So if you look at our product, for example, we have a card that's designed, it's rigid, it's thicker than what's out there. So it creates a structure within the pack that protects the pack. It protects, the laminate from crushing. It protects the instrument itself, from impact and from damage and whatnot. But it also protects from strike through. It protects from instrument moving around that might impact the seals. And it does a really good job of holding the instrument open, a hinged instrument, for example, so that all the sterilant can access all surface areas. So we're focused and committed to creating products that really protect that sterile barrier and everything within that barrier. So that's kind of our mission.
Yeah, that topic is interesting, right? Because as a podcast, one of the first podcasts in the sterile processing space for sure, and then even this event is co-sponsored in partnership with a couple of our other podcast brands, Power Supply, and then First Case. We are in the kind of same position in we saw a problem in that there wasn't enough education and platform opportunities for all the conversations that need to happen in the industry, because it's too much for one group to only have conversations once a year only through these platforms. And we wanted to really democratize all of the types and the kinds of education that you see. And so we saw a problem like you did, and we looked around and said, there's really not a lot of folks that are paying attention to this problem or do anything with it, so let's take a shot at it. And what's unique about your story that I want to hear a little bit more of is that comment that you made, like inside the package, that ecosystem inside the package and what's going on there. It also aligns very well with what the accreditation surveyors are looking for in a lot of our facilities in the OR and in sterile processing. They are taking a look at your pill pack wall and at your pill pack storage, and they are dinging you if you have sterilized them improperly. And by improperly, oftentimes they mean in a way that's not compliant with the wordage of the IFU, which many of these hinged items in the IFU, it states they need to be sterilized in an open fashion or unlocked, right?
Right.
And so you're really aligning a kind of felt need that you saw out there with a big focus right now in these accreditation bodies of, you need to be compliant with the IFUs. And historically, there just hadn't been that many options out there to really tackle that. So,
which is kind of interesting to me, quite frankly. I think that it's interesting to me that there hasn't been that much attention placed on this, on that last 100 yards kind of thing, I mean, we see a lot of energy placed into cleaning verification, sterilization, conditioned sterilizers, all that stuff, which is very, very important, obviously. But, the path that a pill pack takes from a sterilizer all the way to the physician's hands is important as well, So I just don't think that enough vigilance has been placed on monitoring the quality of that path, and maybe, we can provide products that'll help make that path a better one, right?
Yeah, well, to use a vocabulary word out of context here, our pill packs often follow a tortuous path to the operating room, but it's not that kind of tortuous path because they're beat up, they're squished, they're stored improperly, and to expect a clamp or any device inside that pill pack that has not been properly protected to survive that, and the package itself is probably asking too much. So on the innovation journey, though, because I really want to get this out of you, right? You saw the problem. You said, I want to do something about this. What was that next step that you took? Like, was there somebody else out there that also saw the problem that you're like, hey, we both see this problem, let's work together? Did you already have somebody who kind of came to you and said, outside of kind of the parallels, it's like y'all both came together and said, I was thinking about this. Well,
that's a great question. So I actually have a patent on a drill bit package to deliver drill bits to the sterile field easily, right? So,
great.
And I was down in a sterile processing department in East Los Angeles, a small hospital, and the supervisor there, she was like, great gal. She was like, yeah, that looks pretty good. I like your drill bit solution there. I'll take that up to surgery, but I want your card. And I'm like, what do you want my card for? She's like, well, she introduced me to instrument protection and what, their options are currently. And she's like, this falls short because of this, that, and the other. And we don't like using these because of these reasons. But so she presented a problem to me, and I thought, well, I think I can solve that problem with kind of currently the technology I already have. So I started working with her and some other local hospitals on creating a product that would solve those problems for her, right? So we listened to an SPD supervisor who had a problem, and we tackled that problem. And so then, I surrounded myself with people that have different backgrounds, right? So my background now is more in devices, but I approached a gentleman who's an RN. He's director of surgical services, then an MBA. He's got credentials out the wazoo, and he wanted to help develop this product. And then I've got another guy named Larry Patton, that's Guy Phipps. I got another guy named Larry Patton who spent 30 years in the sterility assurance packaging world. So, he brought that expertise to the group, and then Guy with his expertise in working within hospitals and hospital administration, et cetera, and surgery, and then what I brought to bear. So the three of us started thinking about, all right, how can we tackle this problem and give a solution to her, that's going to help her. And so that's kind of how that got started. It's like the need was presented to myself, and then I was interested in trying to solve the problem. And then I brought some other gentlemen in that had experiences in different areas that I thought together we'd be able to come up with some solutions for her. So
I think there's a couple of important takeaways I want to highlight, for folks that are watching this or listening to this. So, number one, you were an innovator who listened to the feedback from the clinical user.
Right.
Not everybody does. I totally get that. But there are innovators out there in our space, and if you approach them and say, hey, I don't like the solutions on the market, or even maybe your solution is okay, but it could be better if you did X, Y, and Z. There are innovators out there like Craig who will listen and will do the years of hard work it takes to bring that idea into concrete fashion in a product or solution. So don't underestimate your feedback. That's the first big takeaway. The second one that I heard is you are solving this problem over here with the drill bits, and then another problem came along that was not the same but related, and then you were able to pivot. So that's an encouragement for everybody else out there who's already maybe solving problems. It's okay to intake these other opportunities and say, hey, this is not what I started out doing, but I could probably solve that problem too. Why not? I got the team.
It's funny you say that, because I watched a mentoring program I'm part of, and this morning he presented a video about innovators that started with one idea, and their claim to fame came with something completely different, but it started with that one that then led down to a different path and a completely different product line that we use today in everyday life, right? Every day. So yeah, you got to start somewhere, and you never know where that's going to lead. But kind of going back to the old thoroughbred, analogy, you got to stay the course and just keep and persevere and keep moving forward. And don't let obstacles get in your way. And you're gonna get stopped. We were stopped numerous times, but we just did a do around. Go around. All right. Well, that wasn't the best solutions, but what is? And let's go back to the drawing board and figure out the next step. And we're going through that now with the product, as a matter of fact. So at first glance, it looked like it was ready to go, but now once we've trialed it, we know that we need to do some more work on it. So. But kind of another going back to, in my spine days, there were engineers that were designing, implants and instruments for surgery that had never stepped in an OR before. And that was just amazing to me. It really was. They had no idea the path that instrument or implant took, from sterile processing into the circulator's hands, into the surgical technologist's hands, and finally into the surgeon's hands, right? So my thought or my belief is you need to have everybody's going to touch that instrument in its journey within that hospital system needs to have a look at it and make a contribution to its development, because that's when you're going to get a really solid and complete package. You may not be able to satisfy everybody. There's some people that say, oh, I want that flap going that way. And then others go, no, I like that flap going the other way. And, you're going to have to make a decision on which you stick with, because you can only have one direction or whatever. So, but you got to get people to look at it and chime in. And that's not always easy, Hank. We did some trials with our hinge protectors, and it's not always easy getting feedback, right? So, I get it that people are going 100 miles an hour and they don't have time, and, they're under a lot of pressure, but it's only with, feedback that we can actually, better the products, and really create something that's going to have value.
That's why I wanted to highlight that first big takeaway from what you said, is that if clinicians felt more heard and that there are innovators that are going to do something with that feedback or idea, but it's important for you to share how long that process is, because you may say, hey, I need this, and you're expecting 3 months later they're going to bring the product back to you and be like, hey, we made it. No, you could be talking 2, 3, 4 years. If you're talking software technology, that stuff takes a long time to do.
Well, especially if you're doing sterilization stuff. You've got validation studies you got to do. You've got to do, all those tests. Create your IFU and and establish the parameters for sterilization, all that kind of stuff. And that doesn't happen fast. So,
and you did a perfect perfect setup for the reason that we launched the Beyond Clean Advisory Group, and the reason that we're going to be launching similar advisory groups through the first case team for the operating room and for power supply with supply chain professionals. But it's to gather active clinicians in the industry who have kind of pre-committed themselves to want to give feedback to improve the products and technologies in this space. So we've gathered all of those folks around the industry through the brand, not only to give feedback like we're talking about today, but also to help us create better education, because education is a product. It is a service, and you need feedback, and you need to pivot, and you need to grow just like you do with everything else. But that's exactly why, because without that voice of the people in the trenches using the solutions or consuming the content, you're off. You're going to be off the mark, right?
Yeah.
You got to know what they really think about it. So that was a great setup.
I want to respond about your product. So your product, Beyond Clean, and the different platforms, that is a great product, what you have right now, because that is helping move the industry forward. Just the content that you guys put out there, put online, stimulates conversation, has other people, that are listening, and there's education pieces, and that gets the companies involved as well. So you don't see that in the device world, really. You don't see it. And, I'm just really proud of you guys and this product that you're putting out there, because it really is making a difference. It really is
appreciate that. Well, there's a lot of unique things about it too, but one of the things that makes our product so awesome is that we get folks like yourself to come and bring all your insight and knowledge into our brand. And that's a unique, typically if you've got a company or brand, it's your internal team that's all about your product and solution. But our platform is different. It's open source. And we get voices in from all over the industry, from all different kind of companies, from all different experts that come in and speak on these topics. And oftentimes there's disagreement. And we're okay and we're comfortable with that, because we understand that's how you make progress.
Right.
I really appreciate the feedback, though.
Sure. Yep.
To go back, and maybe I'll kind of tie in that last piece here too. One last takeaway, though, from what you said at the beginning in this journey of innovation is you realize that you, as an individual, didn't have all of the skills necessary or all of the experiences necessary to take this idea to the next step. So first thing you did is look around and say, okay, who do I need on the team? Who can complement this journey, and then bring him into the fold? Right. But we did the same thing in the launch of Beyond Clean. And it was actually Justin Poulin, the co-founder, who started it. He reached out to me through LinkedIn, and his background was in podcasting and education. And he reached out and said, Hank, you have built this great network through social. You're an advocate for sterile processing. Have you thought about doing a podcast? And then boom, it exploded from there. So that's a very powerful combination of bringing in those diverse perspectives. And I want folks to just hear that, just because you have an idea, it doesn't have to be you that does it all by yourself. You can pull in a team.
Absolutely. You got to do that to have a really, really great, well-rounded product. And one of my strengths is knowing my limitations. I'll be honest with you. I know that I'm not, I do have some strengths, but I don't know everything. And I like it. I like relying on other people. I like, there's some sterile processing, things that I don't know, but I know people that do know, and I'll go get the answers from those guys. Right. So, yeah.
I mean, that's the definition of an expert that I like to share is it's not that you know everything, it's that you know enough to know that you don't know everything. That's when you really start getting to that level. In the last 12 months or so let's kind of, I want to put a timeline on this too. So these are recent conversations, but what are some of the biggest conversations or some of the most common conversations that you've had in the industry related to instrument protection?
Well, our interest is in, like I said, that last 100 yards, right? So we're interested in the conversations that have to do with repetitive handling and aseptic presentation and things like that. So we see a lot of chatter online, thanks to you guys and other companies, like HealthMark and, people like that put on these education pieces and stuff. And then that creates conversation. So, kind of what I said earlier, there's a lot said about, cleaning and sterilization, all that stuff, but not as much with, the PACS, path after sterilization. So, those are kind of the conversations that we are interested in hearing about and want to know more about, and how we figure out how we can be more helpful and what studies can we do. We're looking at that now. We're kind of looking at what studies can we do to determine best path, forward, right? Is our product good enough? Should we do other things, right? Should we look at, really kind of going back to what I said about that ecosystem within the pack, how I've got one of Larry Patton, who mentioned earlier in the conversation, this very moment, he's at a sterilization facility running some tests, right? Doing some off things just to kind of see what happens there, right? So, we're interested in kind of examining that in greater detail.
I know you mentioned, I think at the beginning, how narrow instrument protection is, like a little broader to say like sterile barriers you mentioned, but I'm a nerd when it comes to these kind of topics, and just the scope of conversation, if you really drill down into like what kind of plastic are on these pill packs, or what kind of other like material, the Tyvek material or the paper material, how is that designed, and what is it designed to do, and what is happening during the sterilization process and after the sterile process, and even I think you alluded to the seal, integrity of the seal. Like, somebody should be doing an entire educational session, like a 1-hour conversation just on seals. How do we get these babies right? How do they work? How do you test them? What are the errors? Like, there's so much, but you're right. It's still the very beginning of the industry waking up and saying, this is an area that we need to talk about. We need to innovate around. We need to educate into, and not just with the pill pack, but everything else that happens inside, which is what.
That's it. That's the conversation. Let's have that conversation. What is really happening there? Inside there, and surgery site infections are still there. And we're doing everything we can on the cleaning side, the sterilization side, but it only takes a very, very small pinhole to create a pathway for microorganisms. And, I think that more study can be done there. There is, like you and I have talked in the past before, there's the KIP organization, that Kilmer Innovation group that they gather together about every couple of years, for whatever, 3 years, I think it is. And they look at these things, and you've got packaging engineers there, you've got clinicians, you've got some device people on the device side, right? So, I think they're starting to looking at those things now. I don't know how far we are along on studies and all that kind of stuff, but I see that coming in the future.
For those of y'all who have been tuning into the expert series for a while, you may remember one of our previous experts, Ted May, is very active in the KIP group and the Kilmer group. And all the conversation, like, if you think we're going deep today on packaging, start spending some time with the Kilmer folks, and they will educate you on all the other things that go into packaging from the manufacturer side all the way through to the clinical side, just like you said, Craig. So that's a great shout out to them. And actually, while I'm thinking about it, here's another podcaster out there. He's actually been on the Beyond Clean podcast with us before. His name's Charlie Webb, and he does a lot of validation, like around the packaging itself, around sealing technology. And he's got a podcast called Spot Radio, and it's all about like sterile packaging on track, I think is what SPOT stands for. So anyways, getting back to our conversation, you highlighted that there are some of these conversations started. Like you've already said, there needs to be a little bit more research probably done on these questions. Who or what is driving the conversations that are happening out there? Like when you show up at a department, for instance, who are the ones that are most concerned or passionate about what's happening inside these packages?
Well, I think, it's in the sterile processing department. I think, you've got different groups. Okay. You've got the group that's going 100 miles an hour and they don't have a whole lot of time and aren't a whole lot interested in innovation and moving forward. And then you've got the groups that are, right? So, and like I would assume that every single person watching this podcast and follows Beyond Clean are the group that cares about innovation, that cares about advancing science, moving forward, right? So, yeah, but not everybody's like that, sadly. So, it's sad, but I get it. It's a tough job, and you get there's a lot of pressure, and sometimes you just don't have time to learn new things, or for some people think that way anyway. But anyway, so it's the guys that care. There are some really innovators, within the departments that really care about progress and making things better. So it's from those guys, and you see it online too. You see it in the conversations, after people responding to there's a great group of people that post things, like, hey, check out this instrument that we've got, and this is how we're cleaning this instrument or whatever,
right?
And just individuals that are doing that, and I think that's so great because it does create conversation, and it sometimes creates heated debate. You'll see the comments, and you're like, wow, that guy doesn't really believe in that or whatever, but conversation's good, right? And that allows somebody else to learn that maybe does not, know the answer to this question, right? So, and then, like I said, all the things that you guys post, all the content, and then the companies post, the Ask the Educators, that HealthMark has, for example, and those are good things, and those are sparking conversation, and I think that will bring those things into the light.
That goes back to a comment I think I made earlier in this interview around being able to disagree and then still take those disagreements and improve ourselves or improve the industry. And even if those disagreements are with IFUs, or if they're with industry guidelines, or even the way that like some of the accreditation things are being implemented and executed, like all those things, all those decisions were made by people, and people can make mistakes. And so if enough of us are concerned about something or want more attention placed on something, if we talk about it, to your point, Craig, and if we are bringing that frontline clinical concern back and saying, listen, we need better designed X, and we're not going to be quiet until someone helps us design this better. Like, that will make a change, and that's what I think that you're alluding to. Like, we're seeing a lot more of that through social media, because more and more folks are finding their voice, and they're realizing that they're not alone in their concerns. And that's often it's hard when you're in your facility